You're with Raf Epstein on ABC Radio Melbourne.
So what comes next and when might it lift? Victoria's Chief Health Officer is Professor Brett Sutton. Thanks for joining us.
Thanks, Raf. How are you?
I'm okay. You said today, I'm confident we are getting ahead of it. Can you explain what it is exactly that you're confident about?
Well, certainly we've tracked down a lot of our primary close contacts and identified them early, and the earliest part of the outbreak that had the school students and teachers exposed and some of the cafes, we've identified everyone. They've been in quarantine, and increasingly when they've become cases over the last few days, we've seen them have their entire infectious period in quarantine. So that's beginning to get ahead of it. Of course, there are new exposure sites and some new transmission areas that we've still got some catching up to do. And then when you have these mystery cases, they haven't been in quarantine because we haven't identified them previously. So they're a challenge at the moment. Limited movements because it's been during the lockdown period. Not so many close contacts, but still some chasing to do.
Those 5 mystery cases that were spoken about at the press conference, have any of them been linked since then?
Look, we're getting closer. For the Melton family, we think there are some exposure sites in Melton, and we're looking at potentially linking cases there. So that's not definitive, but it's looking like there's a reasonable explanation there. For the father and son, not yet. There's some circumstantial evidence. They're in the proximity of some cases in public housing, but no definitive link. So we'll continue to explore that. And
the lockdown we are in now, so there's a Derrimut worker and an Altaqua teacher, but you don't know where they received the virus from. Do you think, I don't know if you'll ever know the answer to that, but is what we're going through now, is that a continuation of what we had weeks ago? Or do you think there was another case of someone bringing the virus in inadvertently from New South Wales?
Look, I think both are possibilities. The reality is for our previous outbreak, we had identified and linked every single case right up until the day we got 0 new cases. So to see these cases so soon after that and not to have a clear acquisition for them makes me think they're separate. They can't recall, they haven't identified any of those exposure sites that we had laid out in fine detail. So it does seem more likely to me that it's maybe a separate incursion, if that's the word, and that it had been kind of dribbling along without being tested, without being identified until it kind of exploded into school and other areas.
So should I be worried or reassured? If something's been dribbling along, that sounds to me like we're going to be in lockdown for as long as there are cases in New South Wales, because that's the biggest source of the virus. Should I be worried or reassured?
No, look, I don't think that's the case. We obviously want to get ahead of all of these current cases to drive them back down and to end all chains of transmission, and then to go back to a really heavy focus on making sure that everyone who's coming in from New South Wales for permitted reasons, and obviously they're highly limited, and there's an awful kind of management that we have to do there for compassionate exemptions and other specified workers. We will look to manage that as best we can, but there will always be movement, freight movement, emergency services movements, health workers and other exempted workers. But, we will impose pretty significant permit conditions on those individuals and minimise the number that come into Victoria for permitted reasons.
Can you keep it out of New South Wales? Can you keep it out of Victoria, that whatever's in New South Wales?
Look, I hope so, but there's no guarantee. And, the whole of regional New South Wales is looking to do the same, but they're still seeing cases crop up in Dubbo, in Armidale, in Central Coast and elsewhere. So it's a challenge, but increasingly if New South Wales can turn it around and we can get higher vaccination coverage, there's the possibility that even with incursions that they'll end on their own without a lockdown being required.
Would your job be easier if the lockdown in New South Wales was tighter and broader? Would that make your job easier?
Look, I don't know what's going to work in New South Wales. That's for the New South Wales Health to try and manage. I know they're doing as much as they possibly can. That's the update I get from AHPPC. But cases have been slowly rising. They need to plateau and drive down again, before the risk to Victoria really substantially changes.
Is there any chance you might prioritise VCE students for vaccinations? Do you think that's something they could potentially look forward to?
We've talked about a lot of groups being, potentially priority groups. It is tricky. You make everyone a priority and then no one's a priority. Teachers, students for VCE and retail workers, a whole bunch of others could be reasonably considered priority groups. We understand the priority that exists for VCE students. They're going through a really important time at the moment, between their GAT testing and then exams. At the moment, the way to protect them, the way to allow them to get back to school is to drive our current cases down. Vaccination's not going to do that in the kind of timescale that we need, but we'll consider them amongst other priority groups as our supply ramps up, which is not so far away. It'll come in early September.
Sure. Look, I'll come back to the vaccination rate. Just a brief one. Do you think kids are, this would be hard to answer maybe, do you think kids are going to go back to school this term?
I hope so, yeah. Look, that's what we're aiming for. Certainly don't want to keep them out of school any longer than is necessary, but, we've seen pretty explosive spread in classrooms. We'll try and manage that. Mask wearing is part of it, making sure that teachers and students who are unwell or symptomatic are not attending, and everything else that we need to do around ventilation and infection prevention and control. But it is not an easy space because the Delta variant in a largely unvaccinated group is hard to manage.
Brett Sutton, I just wanted to try and imagine a future when a lot more of us are vaccinated. That national benchmark of 70% of people aged over 16 having 2 doses of the vaccine, I think that works out at about 56% of the population. So if people aren't good at following numbers, that 70% mark still leaves a third of people or a third of the population without the vaccination, without anything in their system. Does that 70% mark change the way you would consider doing lockdowns?
Yeah, certainly. Getting to that kind of level means that the speed and extent of spread over a period of time won't be as great, and especially if we can get that mobile working and student population included as well, because that changes how fast it all moves, and that gives contact tracing a much better chance wherever we are in Australia in catching up with cases without having to have those really significant constraints that all of us would like to see, yes. Be ancient history.
Could you tell us what a lockdown might look like when we hit that 70% mark? I mean, localised, or would you have vaccine to sort of, send to surge into a hotspot area? Have you got any idea what a lockdown looks like in that situation?
Not entirely. We don't know what the dynamics might look like, and in part it depends on the cohort that gets affected with new cases. If it's in a very young student population who are not vaccinated at all, that's going to be tricky, and it might be focused on schools. If it's an older population, we would have much greater confidence that it'll end on its own or end with the contact tracing that we can do really effectively and rapidly now. In that middle age group, it might be more limited restrictions rather than the very harsh and very strict lockdown that we're in currently.
A lot of people want to know when their double dose is going to mean the lockdown rules don't apply to them. Is that in our future?
I hope something akin to that is in our future. I've said many times I think it's really important to get nationally agreed standards in that regard so that it can be applied equitably. It's clear that you can be fully vaccinated and still catch the virus and still pass it on, but it does limit the transmission for those who are fully vaccinated, and we should be able to consider that in terms of how people move around. But we also know that if people see others moving very freely, yes, and it's not clear that they're fully vaccinated, what kind of a signal is that sending? So it needs to be managed sensitively and equitably.
Those benchmarks that everyone is talking about from the Doherty Institute, 70%, 80% of people aged over 16 years. Are we going to get there? Not every country finds it easy to find that many people who want to be vaccinated. Are you confident that Victorians want the vaccine that much will hit those benchmarks?
I think so. I mean, we all hate the lockdowns that have been required to manage this. We all want a future where we can move freely for our holidays, to see friends and family, and to move for those compassionate reasons across state boundaries. And we've got a long and fantastic history of high vaccination coverage for vaccine-preventable diseases: measles, mumps, rubella, whooping cough, polio, terrific targets, more than 95% in our childhood vaccination program. So there's a real commitment to vaccination and understanding of what it means in terms of preventing illness. So I'm confident that we can get there, but time will tell.
Will you ever consider localised lockdowns? Do you think that's ever going to be part of the armoury?
It's not out of the question. I think if it were an outbreak in regional Victoria in particular, that might be relatively limited and with smaller movements to other areas, that's possible. If it's in a place where there's really substantial movement across a number of settings, it becomes really tricky to manage. And that's why we've gone to metropolitan Melbourne so often, because the movements across Metro Melbourne are really substantial for essential and permitted reasons.
I do have a specific question here about outdoor trades. Tony wants to know, he reckons it suddenly appeared overnight that outdoor trades can now work, that they have been put onto the providers list. Do you know if that's been added to the list, Brett Sutton?
Yes, it has. It happened Tuesday midnight, so change, an update to directions then. I think the Victorian Building Authority tried to put it out to their stakeholders, but there'll be some other solo workers, gardeners, and other outdoor maintenance workers who may not have heard. So, right. Yes, that's a change to the permitted workers list, indeed.
Okay, that's good for everyone that it involves. The lead into Christmas, am I looking at 2 weeks out of every 4 a lockdown? Do you think that's possible?
I hope not. Look, we will continue to strengthen our protections at the border, for the permitted workers list, and in the management of exemptions as much as possible. It will become less and less likely the higher our vaccination coverage gets, and we are really pushing ahead now. We've seen a quadrupling of AstraZeneca first doses just in the last couple of days. That'll continue to increase, and I think we could see 200,000 Victorians getting their first dose on a weekly basis, between increased Pfizer supply and an increased, willingness and distribution of AstraZeneca.
Most important question. On a donut day, do we eat one donut for each donut day, or one donut for each day we were under lockdown?
It depends on your desire for donuts. I think, look, there's been a critique of celebrating donut days, a kind of fetishness, I think Osman called it. It's not a fetishness. It's celebrating a really difficult achievement. And everyone knows what it represents. It represents the beginning of defeating another outbreak, which is no guarantee. It is no guarantee in New South Wales. We've seen that. And so we should celebrate the efforts that everyone makes for us to be able to get there, with a recognition that we might have another challenge on the same day or just around the corner. But by God, the efforts that everyone needs to go through to be able to get there are so substantial, and that sacrifice should be celebrated. Whether it's with one donut or 23, I don't really mind. Let's enjoy it for those occasions, to recognise just how much everyone has made an effort to be able to get there.
Thanks for your time.
Thanks, Raf.
Professor Brett Sutton there. He is Victoria's Chief Health Officer.
Raf Epstein on ABC Radio Melbourne.